warm welcome to representatives of the media and to our special guests today. This is part of our continuing series in which we are bringing health professionals to share their knowledge and experience with us as we continue in the fight against the COVID-19 pandemic. In this one, we have brought together the Executive Director of what's known as CARPHA, that stands for the Caribbean Public Health Agency, Dr. Joyce St. John. The Chairman of Grenada's COVID Health Subcommittee, Dr. Bert Brathwaite. St. Lucia's Chief Medical Officer, Dr. Sharon Belmar-George, and the Acting Chief Medical Officer in Barbados, Dr. Anton Best. They are here to share their experiences with COVID and to update us on where they are now. And most of all, what are the lessons learned so far? Welcome to you all. And we start with a regional perspective from you, Dr. Joyce St. John, from CARPHA. What has this experience been like, especially as it relates to the Delta variant?
So the experience has been what I call a global best practice, because we have had a coordination of the planning and execution of the CARICOM response to COVID-19, not only from the perspective of health, but also the heads of government have mandated common protocols, and they've also executed a whole of society response. So for the first time, and this I'm talking about since my experience as a public health practitioner, you are seeing a focus of all of society, not just government, not just public sector, not just private sector, but all of society on a health situation and an understanding somewhat of what should be the responses, the understanding of distancing, the understanding of the need for hygiene and sanitation. We've been lucky. We've had really good numbers in terms of cases and deaths. CARPHA tracks this on a weekly basis, and we do a comparison with the other states in the Caribbean and also the rest of the Americas region. And we've been doing very well with the numbers. But everything changed with Delta. Even though we had Gamma, which was really, it took quite a toll, especially on Trinidad. But Delta has changed the game because of the transmissibility and the struggles that have occurred in the last 3 months or so across the Caribbean. That is testimony to how transmissible Delta is. And it also showed up some of the weaknesses in our response, which is the understanding by our population that they have to play their part. They cannot only expect that the response should be for non-Caribbean citizens or tourists, but the response also has to be on the national and very personal level. Over.
Thank you very much, Dr. St. John. Next, let's hear from Dr. Bert Brathwaite, Chairman of Grenada's COVID Health Subcommittee.
Thank you, David, and good morning to fellow panelists and to listeners and journalists present. Yes, our experience here has been one that initially we watched as, much of the rest of the world was aggressively hit by the nature of this virus. And then up until September, end of August, having only had one death, and at that point, probably about 60, 70 cases, if my memory serves me correctly. And then all of a sudden, in the twinkle of an eye, everything exploded upon us. And we found ourselves in a situation where over a period of 5 weeks, we had pretty close on 180 deaths. And at present, we are at just 197 deaths or so. So obviously it was a very tormenting time for everyone involved, for the people, for the planners, for those in the health field, etc. And we fought to bring try to arrest the situation. I think we have, to a large extent, successfully done so in the short term. Left to be seen how we can manage the situation now in the medium and long term. Right now, our case positivity rate is down to around somewhere between 2.5 and 5%. And we opened many sectors of the community and schools. Some sections of schools are about to restart next week, that type of thing. So it's been a very, very challenging over that 6-week period, very challenging. The one thing that happened that was positive was that quite a few people came out and our vaccination rates moved from about 18% to about 32% fully vaccinated, which is still far from ideal, but at least we've got those vaccines on board. So that's where we are presently in Grenada.
What is it that you have done to bring the situation under control? There are those who would be keen to find that out, especially in light of where we are in Barbados right now.
I think it's a combination of a number of factors. First of all, it was about all hands on deck. We had quite a few volunteers. We closed on Saturdays and Sundays. The country was shut down for 4 weeks. There was no activity. The only activity on the roads was supposed to be obviously essential services. And for those who were going for vaccinations or going to be tested. And we got quite a few volunteers come out and they moved right around in the communities. Folk from St. George's University helped the Ministry of Health officials, and they worked tirelessly as the Ministry of Health officials to try to, that's both from the medical, the nurse, and the full team to get the vaccines in and to test people. And obviously people went home and isolated. Now, what happened spontaneously is that before government shut down, a number of offices closed down. And so that obviously decreased the spread. During the week, there were quarantine time up to, you had to be home by 6 o'clock. That is now just being moved to 7, and it's now 9 p.m. that you have to be home. So during the week, lots of business activities didn't take place. It was mostly the essential services, your supermarkets, your pharmacies, etc., and your petrol stations, and one or two other services that were allowed to go on. Anything else that had to go on went on virtually. Of course, that had a significant social impact on the community in that many people, their livelihoods would have been tremendously affected. But it was a concerted effort by all forces to try to bring things under control. And so far, it seems the news seems to be good, as I said, in the short term.
Well, thank you. Let's hear next from Dr. Sharon Belmar-George, the St. Lucia experience with COVID-19, and especially as it relates to Delta.
Good morning to everybody, and thanks so much for having me participate to share our country experiences. As most of the other islands, we got our first few cases in March of 2020. For us, we have considered that this Delta wave has been our fourth wave. The other three being quite small, especially the first two. The first one was in March, and we had another small wave in October, in January of 2021, and in July of 2021, now with the Delta variant circulating. Our biggest challenge, like everyone else, has been managing the Delta variant. For us, with our first three waves, we saw a total of 5,529 cases, but with this fourth wave, with Delta on board, we noted over 6,000, almost 7,000. So more than half of the cases that we have diagnosed in country has been with the Delta variant with an average of about 75 cases per day. We also saw the increases in our deaths as well. So just with the fourth wave, we noted over 150 deaths, whereas we have recorded 241 deaths from March till this time. We've been able to, we think, successfully bring down the other waves a lot more efficiently than the Delta variant, the wave with the Delta variant. From very early, even before we actually got confirmation through gene sequencing of the Delta variant, we saw the difference. We saw younger persons getting sick. We also saw younger persons coming in more severe within our respiratory hospital. So we did suspect that there was something different. Also, the rate of transmission was a lot higher managing the Delta variant as compared to the other waves that we managed in country. So we knew that our management had to change if we were to control. We are pleased to show that we now have 350 active cases as compared to over 2,000 during the peak of our management of the Delta variant. We are also seeing reduced transmissions. We've gone down to 20% as compared to 80 or 90% hospitalization that we saw during the peak as well. We are also having less persons accessing our respiratory hospitals as well. So our respiratory clinics, sorry. So we are seeing the reduced transmission steadily, and we have been able to commence with the phased reopening of schools and to allow access to some of our services for the services that were closed. So we've seen vast improvements at this point as compared to August, September, when we were in the height of the wave. Thank you.
What would you identify as the key planks of the management that you brought to control the Delta variant?
For us here, I think having the Delta variant with our fourth wave is quite fortunate because we've learned a lot managing the first two waves. We use a lot of the data coming out of our cases to guide the recommendations that we would make through our COVID-19 management committee. And that has helped us. When we closed St. Lucia in March, we opened the country using a phased approach with 5 main pillars. We were able to do an assessment looking at what were the most essential services and also the highest risk services. And we are in phase 5 where we are living safely with COVID. We use targeted interventions to make our recommendations. So coming out of contact tracing, what we are able to see for us from a local level, which are the high risk areas causing an increasing transmission, and we target those instead of using a whole approach. For some of the sectors, for example, our supermarkets and banks who adhere to the protocols well, so we won't get transmission from those sectors. But our bars, our social activities, large events where we see the cases coming from, so we're able to target where we see the cases coming from and make recommendations. And this has worked quite well for us. One of the disadvantages for us is the high level of vaccine hesitancy that we continue to confront in country, and we're working at the level of the community to see how we can increase the vaccine uptake. So this has been one of the disadvantages which we have had, the high rate of vaccine hesitancy that we continue to see at the level of the community. But what has really worked for us is those targeted interventions using the data that we get in country from our cases where we are seeing the trends for increases and actually targeting those to bring those numbers down.
I'm sure there are those who would want you to be a bit more specific about the targeted interventions that you've used.
Yes. What we have noted, a lot of our cases are coming from social events, mass crowd activities. So for us, last term, we were able to keep schools open, and the Ministry of Education worked closely with us. We were able to have a safe environment where we had minimal spread within our school environment. So we made a decision for September, given the increased transmissibility of Delta, to hold off, because we were in the peak for the opening of school in September, to hold off, for example, from opening school. So we delayed the opening of schools until last week when we opened schools in a phased approach with the critical years first, and we will be looking to open some of our other school years. One of the other issues is the bars. At that level, we noted quite a few outbreaks at the level of our nightclubs and bars. So we stopped the sale of alcohol at that level, also from restaurants with nightclubs as well. So one of the interventions which we did. The other intervention that we were able to do is the closure on the weekends. Friday nights and Sundays are our highest risk days due to the number of social activities that are usually planned there. So our lockdowns, our curfews, and our confinements targeted these times of most activities. For St. Lucia, on a Sunday afternoon, it is typical to have large beach activities on about 5 beaches around the island. And we tried everything to close those beaches so we don't affect the whole Sunday, especially for the religious groups. When we close a Sunday, it's difficult for them. So one of the tough decisions we had to do was confinement from early afternoon Saturday to the whole of Sunday to reduce the risk that a Sunday afternoon was posing to our population. We also had to keep curfew days from early during the week as well. So a lot of those measures, it was really to reduce the socialization and the social activities. For us specifically in St. Lucia, we only recommend the work from home in environments where it's not safe in terms of the number of people and the size of the organization. One of the things that we have learned on a local level, if you close schools, if you close workplaces completely, a lot of adults group up and have social activities, and it now becomes a new risk. So generally for us, the work environment is a more structured and a safer environment. So asking people to stay home is not a safe environment because it now creates a new avenue for socialization and new activities to stop. Another risk which we noted was our minibus sector. We had a lot of issues with getting them to comply to the recommended numbers on the bus, use of face masks on the bus, and also the sanitation required between trips. So we had to reduce the numbers on those buses and ensure that there was enforcement at the bus stations and also on the way, because this was so important that we managed that. We did get an outbreak among the minibus sector. We had hospitalizations and deaths among them based on the non-adherence to protocols. We had to resolve this issue before we could have advised on the safe reopening of schools.
Thank you. Dr. Anton Best, share with the panel the Barbados experience so far.
Sure. So good morning to all viewers. Good morning, colleague panelists. Thank you very much, Mr. Ellis, for this opportunity to say a few words about the Barbados experience where the COVID pandemic is concerned. So when we got the alert in Barbados in January of 2020, we stepped into action immediately. Within the Ministry of Health, we established a Health Emergency Operations Committee. And the purpose of that was to provide oversight and to coordinate a series of activities and to advise the Minister of Health on policy matters pertaining to COVID-19 and in preparation for the pandemic landing on our shores. We did a lot of preparatory activities. We took a look at the governance structure that was required. So right now we have the Health EOC, which reports to a Cabinet Subcommittee. And then, of course, decisions are ratified by the Prime Minister and the wider Cabinet. We looked at our healthcare infrastructure that was going to be required. So we strengthened the healthcare infrastructure. And by that, I mean we have quarantine facilities, dedicated quarantine facilities. We also have an isolation facility at Harrison's Point. And of course, later on in my presentation, you hear we actually have up to 6 isolation points at this current point in time. We looked at the human resources that were required for a response to COVID. And in doing so, we decided we needed assistance in the form of a Cuban medical team. That would have started in April, I believe, of 2020. We also brought in nurses from Ghana. This was actually an arrangement that was happening prior to COVID, but certainly in light of COVID, we needed the extra capacity in our healthcare facilities. We also added community health liaison officers. These are public service posts that were created for the purpose of outreach. So you have these persons who are based in the polyclinics, who have what I would describe as tentacles, and they're on the ground in the communities doing the necessary outreach, being able to educate, being able to promote health, being able to help identify persons that need assistance where COVID-19 is concerned. We also established a COVID monitoring unit for enforcement of the COVID protocols. Then we had the first wave. So the first wave of COVID was in March of last year. And 2 weeks after that, we had our first lockdown. We eventually came out of that first wave, and we, realizing the impact that COVID had on the economy, we reopened the commercial air travel in Barbados, and I believe that was around July of 2020. And one thing about that I'd like to say is that the protocols that we implemented were rather novel. We didn't have a guidebook. We didn't have guidelines to tell us exactly what to do. We had to figure things out as we went along. So to protect the health of tourists and to protect the health of nationals, we needed to mix testing for screening and quarantining to be able to prevent and control the spread of COVID-19 in Barbados. Around December of last year, we had a very aggressive second wave due to the alpha strain of COVID-19. And a few weeks after, in February of 2021, we had a lockdown. Some initiatives that came out during that time were the Seek and Save initiative, which was a partnership between the government of Barbados and the University of the West Indies Cave Hill campus. Also in February, and a very pivotal moment in our response, was the inception of the National Vaccine Program. We continued to have cases as the second wave petered out over many weeks and months, but then we now have a devastating third wave due to the Delta variant, which we've talked a lot about. And in fact, I would almost argue that the Delta wave is almost like a different pandemic that we are facing, because this one is not playing by the rules. So we are well aware that COVID disrupts lives and livelihoods. It's crippled our economy. It's led to social disruption. In terms of healthcare specifically, it's led to hospitalizations. It's led to unfortunate deaths in Barbados. And it has had an adverse impact on other healthcare services. So where are we now? If I take a look at the dashboard that was published yesterday, the 27th of October, for the day before, with the 26th, we had 391 cases reported. And this was out of just about 2,100 tests that were conducted at our public health lab. 184 of those cases were males and 207 were females. We have 5,414 active cases of COVID. These are persons diagnosed with COVID. And only a fraction of those are in the isolation facilities, the 6 isolation facilities that I would have alluded to earlier. So we have the majority of active cases are in home isolation. And of course, this puts a lot of responsibility on the community and on people to do the right thing if they're COVID positive when they remain at home. In September, we would have implemented a home isolation project. And of course, that was to supplement the work that is being done by the polyclinics as well as the isolation facilities. In terms of deaths, we had, let me just put the current situation of deaths into comparison. So in August, we had 4 deaths due to COVID. In September, we had 29, which was an alarmingly high number at that time. It's not yet the end of October, and we've had 69 deaths so far. So we more than doubled the death tally for all of September. Now, yes, we are seeing an increase in the number of deaths, but we also want to look at the proportion of deaths, what we call the case fatality rate or case fatality ratio. So the case fatality ratio is not that bad. It's actually about 1.3%, which is very good compared to other countries. But yet still, this ratio that we're looking at does translate into souls and lives lost, which is very unfortunate and something that we want to eliminate as best as possible and keep as low as possible. So I would have mentioned the onslaught of the third wave due to the Delta variant, but another pivotal moment in our COVID-19 history over the last 19 months was the inception of the vaccine program, which I mentioned. I do not know where we would be if we did not have vaccines to help prevent and to help reduce the mortality associated with COVID. So as you've heard from the other panelists, the Delta variant has ravaged other countries. This is happening across the world. So Barbados is not alone. So we've seen significant morbidity, mortality, social and economic disruption due to COVID. And going forward, what we need to do is to continue to apply the appropriate public health and social measures to help further curtail the spread of COVID-19 in Barbados. We need to continue risk communication. And by that, I mean, we need to sensitize people. We need to educate the public with the intention that it would change their behaviors. We need to provide access to vaccinations and encourage people to be vaccinated. We also need to detect cases early, isolate, identify persons who are ill, identify persons who are vulnerable, and get them into care earlier. When you get people into care earlier, the chances of survival and for positive outcomes is much higher. So right now, in light of a devastating third wave due to the Delta variant, our emphasis is on saving lives.
Thank you, Will. As panelists, what do you detect as the strategies that you have adopted in common? And where have you seen differences in the approach, to especially the Delta variant? And perhaps Dr. St. John, you can take that one.
You want me to take it home? Well, anyhow. So what is clear is that, like Anton said, Delta is almost like a whole new pandemic, I should say. Before, and we in the Caribbean were very lucky. Before, with Alpha, one case could cause transmission to 1 or 2 people. In a room of 10 people and someone walks in with Delta, maybe 8 of those people are going to get Delta. It is that transmissible. Majority of them will have mild cases, but we don't know who. And because the Caribbean is set up with so much non-communicable diseases on board, perhaps this is why we are struggling when we have Delta outbreaks, because we have a lot of even young people with at least one comorbidity, hypertension or diabetes, asthma, some other lung disease. And then of course we know people with compromised immune systems, like people with lupus and so on, will also struggle. So if we're talking about taking it home, the only way we're going to get out of this hole, and my apologies straight up front to the anti-vaxxers, is to be vaccinated. I'm not saying that the vaccine will stop you from contracting it, not at all. But it's going to stop you from having the very severe forms and usually dying. The caveat is if you're someone with a lot of comorbidities, even if you're fully vaccinated with an approved WHO vaccine, you still are at greater risk, even though you're fully vaccinated. So Delta is the version that has really found the chinks in our public health armor and opened them wide. And we've got several people falling through the cracks in terms of illness and unfortunately death. I think the advice that CARPHA gave initially, which was to always monitor what's happening internally, always ensure that your level of illness does not overwhelm your health services. And if there is a risk of that, putting strategies in place to reduce transmission. That is the take-home story from the discussions that we've heard. Even though we do that, because of that high transmissibility that I told you, we will still struggle with some issues. And I think it's very difficult for me to watch what's happening in Barbados, because I never thought I would see this day because of the layered response that Anton described. There are so many layers to not only implement, but checks and balances, which is always a good thing, to be always evaluating what you're doing. I never thought I would see Barbados struggling the way that it is. It hurts me. You know, I have a thing about unnecessary illness and death. I cannot stand it. So it hurts me to see it. But remember, this is something affecting the whole society. And it is the heads of government who are leading this charge. And the heads of government have another pandemic that has come about because of COVID-19. And this is the issue of the onslaught on the economy. So we are seeing the balancing of lives and livelihoods, I think, in some of our responses. Finding the right balance to minimize the losses either to the economy or to the human capital, because remember, our greatest capital is our human capital. To find that balance is not always easy, but I think the one thing I can say about the Caribbean heads of government is that they are not shirking. They're making the tough decisions.
Dr. Brathwaite, and then Dr. Belmar-George, and then we go to the media.
Yes, David, I just to follow on from what but even before I follow on from what Dr. St. John just aptly put, I just omitted one group of people that were essential in the return to some degree of control in Grenada. We had great support from in the region and especially in North America and UK. The diaspora came very much to the support of Grenada in terms of sending in supplies, because, as you know, in the midst of a pandemic of this nature and with the hospitalization rate at that time, you're going to use up quite a bit of PPEs, etc. But we also are always on the borderline in terms of personnel to handle day-to-day care. So and the system was placed under great stress. And some of the individuals came in from North America, and there were other groups that came, and one group came in from Mexico for a short while. But especially the folk who came in from North America, some of them spent as long as 3 weeks there, and these were, in some cases, infectious disease specialists, etc. And the country is eternally grateful to them for, coming in and placing their support at a critical time. One of the things that concerns me as we think of the future, along with what Dr. St. John mentioned, was the question of there's a lot that is still unknown about the SARS-CoV-2 virus. And in addition, we know of the long COVID symptoms, but one worries as to the school of thought that says, well, I'm young, I can get it, and I'm possibly not going to have much in the way of side effects. Well, I think that the people who make those statements should be making them in a very guarded way, because they don't really know when that virus gets into your system, if you've not been vaccinated and goes into cells, many tissues around the body, even though you are not have not been significantly affected, you've been mildly affected or asymptomatic. Some of those folk go on to get long COVID features. So in the same context, and in the context where you hear of change of cell function, etc., by the virus, one worries that we are not able to get a higher level of vaccination into our folk. As I said, we are at about 32%. By the time we get a lot of people with their second doses, I suspect we'll move up to 35, 37% or there around. And if you add to that, probably 20% of the community that has already acquired it, that still leaves you somewhere in the 50% here in Grenada in terms of effective immunity. And that's not good, as we have seen in many countries. As a matter of fact, there's countries that have gone up about 80%. Singapore has something like 84, 87% fully vaccinated, and they're struggling at present with their what I anticipate is a pretty sophisticated health system there. So there's a lot more to this virus that meets the eye, in addition to the horrid situations that we here at Grenada have had to face, and as my colleagues have described, many are facing around the region.
Dr. Belmar-George.
Thank you so much. Similar to Barbados, for us in St. Lucia, over the period from March to now, and even more, we saw it even more in managing the effects of the Delta variant. We've had to extend and strengthen all of our systems to manage, and that is for contact tracers, our respiratory hospital, put extra staff into the respiratory clinics, suspend elective surgeries. We had to reform even our primary care sector to ensure, especially during the peak of the wave, that we could provide care to prevent deaths. For us, this remains of concern. And up to this week, we did an analysis because in managing COVID, our regular programs, the effect of those regular programs that we manage, our other vaccination, our child health vaccination, our child health programs, our antenatal programs, our chronic care patients that we have been dedicated to providing care for, we've had to take nurses out and put them in vaccination clinics. These are nurses who would be going to the elderly, going to the homes, calling to make sure that our 1 to 5 year olds are fully immunized. So we are looking at ensuring that there is a balance. We know some of our indicators are already falling back. So we are looking at creating the balance to ensure the very patients that we need to keep healthy so they could survive COVID and also keep healthy for the long-term reasons, that we don't end up just managing COVID and our other programs don't suffer. I will not go through what countries will, we don't know what we will be facing, and we need to be prepared for the effects of long COVID. The number of persons that we've already diagnosed in country, what will be the burden of disease next year, later on, in terms of possible complications to their health conditions. And a lot of those are young people who may have managed quite well. This is a new disease. We don't know what the long-term effect down the line that our health system has to be prepared to manage. Dr. John mentioned the health and economic aspect of COVID. We are also looking at the educational effect. Our children have been out of school for almost 2 years. The quality of online learning, where we have communities where children don't have devices and internet. The number of dropouts that we have seen, teenage pregnancy, children that have now become smokers on the block, how we call it in St. Lucia. So the effect on the youth from not getting the benefits of face-to-face instruction, the discipline, this we are going to see in a number of areas later on that we as societies will also have to manage from the effects of COVID. But in all of those disadvantages that we have seen in terms of the health, the deaths and everything, I think what we also need to look at, and I am really working to ensure that for us in St. Lucia, we're able to sustain it. The one advantage that COVID has presented, it has allowed us to strengthen our public health system. And I say that when I look at the support we've gotten from PAHO, from CARPHA, from regional agencies, the training. For us in the Caribbean, I think this is probably the strongest that we have seen our capacity to test, which we could not do before, our surveillance system, our capacity to diagnose. I think our systems now will be better able to manage, even our port health program as well. We would better be able to manage anything when we move past COVID. So I'm really hoping a lot of the measures that we put in place, our governments recognize and see the importance of it to be able to sustain it so that any other outbreak, and we expect others to come. I don't think COVID will be the last at any point, that we able to maintain and build on what we have already seen in country. Thank you.
Thank you. Let's now invite questions from the media. And as usual, you identify yourself and the media house that you represent.
Okay, I think I'll start. Marlon Madden, Barbados Today. I want to find out from Dr. Anton Best and possibly Dr. St. John, if you can honestly say that the current measures are working, given the number of cases that we are seeing in Barbados in terms of positivity and the deaths in the past few weeks that we mentioned, or is it that we're at a stage now where we're, living with the pandemic, so to speak?
So let me answer it this way, Marlon. That was a great question. Are the current measures working? If we did not have the current measures that we have right now, which would include the curfew, which would include working from home where applicable, kids not being in school, the rate of transmission would be significantly higher. There's something called the reproductive rate of a disease, and this is what Dr. St. John was alluding to earlier. So the alpha strain, the reproductive rate is about 2 to 3, meaning that one case of alpha would lead to 2 or 3 new infections, okay? Delta, the reproductive rate is in the order of 8 to 10, okay? Our effective reproductive rate that we worked out is about 1.4, if I remember correctly. So we're still getting a lot of transmissions. What we want is that reproductive rate to be below 1 so that we can say, look, you know what? The epidemic is coming down, but it has to be below 1, right? So I would argue that, yes, we do have a situation where we have a lot of cases. And unfortunately in Barbados, the incidence or the rate of cases is increasing, but the measures are working to some extent. Had we not had those measures, we would be getting daily cases of thousands, not just a few hundreds, thousands. So I guess you're also asking, can we do more? And the answer is yes, we can absolutely do more. But at this particular point, 19 months into the response in Barbados, we know a lot. We know what works. We know what doesn't work so well. There's tremendous amount of evidence regarding the public health and social measures. But right now, we really need for people to make better choices. I would argue that people are not making the best choices, not only for their individual health, but for the health of others with whom they live, for other persons in the community, and for the society at large. If more people adhere to the protocols that we have out there, which are effective, the numbers would go down.
Dr. St. John,
if I may, sorry.
You put the question, was put to Dr. St. John as well.
Are the measures working? I think that we've got a really formidable foe. And I think what we're dealing with is the reality of Delta coming into an environment where there is a lot of vaccine hesitation against the COVID vaccines, as well as a rather sophisticated strategy from anti-vaxxers to actually prevent people from being vaccinated. So if there is a measure that we need to improve on, it is, as Dr. Best said before, it is the whole issue of communication so that you get more people to be vaccinated quickly. If we had better vaccine statistics, We heard Dr. really good explanation of this whole issue of how vaccination, population vaccination makes a difference. If we had more people vaccinated when Delta came on shore, even if Delta was able to cause some infection and slight disease, we would not have the levels of persons in primary and secondary isolation, or these unfortunate deaths at home or deaths that occur in accident emergency, which signal that people waited too long and came in moribund. So I would say that we are seeing in Barbados a rather unfortunate play out of a series of events that have come together and not in a nice way. Over.
There's a question.
Mr. Motsi?
There's a question here from Katrina King, who says that she's from Nuke News, but her mic isn't working. She wants to know your thoughts, Dr. St. John, on Barbados' new travel protocols, given the rate of transmission.
Specific travel protocol that she's referring to, is this the removal of the PCR test and the quarantine?
So she didn't specify.
Well, I can speak to that because I recently came into Barbados and I quarantined. I have to say that with statistics as were presented by the Minister of Health of the kinds of returns of positive COVID-19 tests from the tourists that are coming in, it's really very difficult to maintain an argument for a Minister of Finance to keep pouring that kind of funding into testing when you're getting less than 1% of the test being positive. At the same time that you are seeing a clear increase of transmission in the community, and you need to be able to test the community. The supplies in the wider world are dwindling for testing. So you need to be strategic. So from that perspective, I understand. However, I would exhort Dr. Best. He's acting right now, so I'm talking to him. I would exhort Dr. Best to ensure that there is enough testing and also strategic testing, not just scattershot. You've got to do some testing from certain sending countries to ensure that you will capture the inevitable introduction of the Delta Plus range of variants, because Delta Plus is a heading to capture, and make sure that you send the samples to CARPHA quickly enough that we can detect the Delta Plus, please. And when you stop acting, tell Dr. George that too, Dr. Kenneth George.
Do you want to respond to that, Dr. Best?
I'm going to respond.
I'm going to respond to that, but I'm going to respond to that in numbers. Just a couple of days ago, Mr. Ellis, we had 445 cases in a single day. The daily average of COVID cases detected is 353. If you just say 400 is the number in one day that we got, that was more than double all of the positive cases that were detected at the airport from travelers. And that's all travelers. What we did for the travel protocols, as Dr. St. John said, we said, look, we are pouring resources here, but guess what? We need resources elsewhere. And we need the resources in the community because we have not just a little community spread, we have a lot of community spread. We got a ton of community spread in Barbados. We need to do more testing. So the resources have been deployed elsewhere, right? And that, to my mind, is being strategic and rational use of existing resources. We're not getting bang for the buck regarding what we're doing. There will come a time when we don't have community transmission anymore. And at that particular point in time, we're gonna have to relook what it is we're doing at our points of entry. The situation is very dynamic. And as the situation changes, we like to respond as tactically best as possible.
But she did raise the issue of surveillance as well. And,
yes. So Dr. St. John raised the issue of genomic surveillance, and that is something that we are paying very close attention to. We're looking to bolster the capacity in-house as well. But in the interim, we have the CARPHA labs in Trinidad, where we send samples to, because this is something that is very, very important, something that we've been paying very close attention to for the better part of 2021. So thank you very much for that advice, Dr. St. John. But we're on it.
Colville Munzi.
Yeah.
Yes, hi, good morning. Colville Munzi, Nation News. A quick follow-up on Marlon's initial question. And I'm premising this with the points raised by the CMO of St. Lucia. That's Dr. Sharon Belmar-George, which would have indicated that the measures that would have worked in bringing down St. Lucia's cases would have been like no movement days and stricter restrictions. And based on that premise, the initial question asked by Marlon in terms of are our measures working? Could you square the outcome in St. Lucia with what we are having right now in terms of our measures? What worked in St. Lucia? Sorry, in terms of what we are having now with our measures.
The question is directed to me, I assume.
I'm not answering it, CMO.
All right. So we have public health and social measures. So the WHO and other agencies like Pan American Health Organization and CARPHA have a suite of evidence-based interventions that they recommend. We've known about these interventions from the beginning. The evidence in support of them has changed over time. Some interventions have become even more important. But the one thing that we have known from the beginning is that you can only apply public health and social measures that the society can tolerate. So yes, we can apply stricter restrictions specifically for COVID, being very myopic, but there's going to be other fallout that is going to impact us once again if you're looking at the entire health system. So there's economic fallout, there's COVID fatigue throughout the society. It is a balancing act. So this is not a straightforward situation of let us just apply more protocols to get this particular outcome. Getting that particular outcome comes at a greater cost. And in some cases, you don't even know if applying the protocol is going to lead to the desired impact. So we are trying to be as strategic as possible. Every single day, we're coming up with different strategies. We're looking to strengthen the resources that are already out there. We're looking to implement newer initiatives. We're trying to be as innovative as possible, but it is very difficult. I will stress again, what we do know is that personal behaviors are driving this epidemic in Barbados. It's driving the pandemic globally. So if more people adhere to the public health and social measures, such as physical distancing, such as hand hygiene, right? And by physical distancing, I mean not gathering, okay? If more people got vaccinated, we can get to the end of this. The impact of COVID would be lower.
Dr. Brathwaite, I think, had a comment to make.
Yes, David, I hear quite clearly what Dr. Best has said and Dr. St. John's reply with respect to resources and the level of results they're picking up the act from in terms of folk coming into the country when they test them versus the necessity to have massive testing in-house. And I just want to sort of make a general comment, not specifically related to Barbados, and that is to carry our minds back to a year or so ago, when a year plus, we looked at countries and we placed them in zones, as it were, so that if you were coming in from a high-risk country, you would be treated in a different way, and your testing and perhaps quarantining would be different than if you were coming in from a low-risk country. And I just wonder if that still is not a relevant way for us to consider going. That is, look around and keep a close eye on all the countries where they're low risk. And yes, when you enter, you just enter with a PCR. But if you are coming, if we, for argument's sake, had forewarning of what was Delta, well, we knew Delta was increasing in the United States. But in hindsight, if we had been able to set up to be more vigilant about people coming in from United States, because we do believe the Delta here came in Grenada came from the United States. Actually, it was spread around because people failed to obey the government beseech people literally not to go to have carnival activities. And you remember there were still carnival bands and things like that, jab, as we call it here. If we had been able to have greater checks on folk coming in from the States at that time, we would not have completely averted it, but one wonders to what extent we might be able to have limited the introduction. So just a general comment about the role of as I see it anyhow, of limiting introduction of especially of new variants.
So we have very strict protocols for these visitors and their ability to be able to roam freely into country, because we know the initial risk of entry, and given some of the low compliance that we note among our population, we know there is a potential from cross spread once this comes in. So we do surveillance coming in, we do surveillance at the various accommodation sites where our visitors come in, and we also do surveillance within the communities at our respiratory centers that have been set up at strategic points as well. So this gives us the capacity to be able to pick up early when we start seeing cases, and also to put measures in place in a timely manner. And since most of our recommendations, now that we're living with COVID, we implement targeted interventions to reduce the impact on the economy and daily living as well. This has worked for us in the management of our past waves. Thanks.
You are suggesting, of course, that the approach to the protocols is influenced by vaccine uptake as well.
Yes, and we are able to see, for us, like I indicated, one of our disadvantages in country is the high vaccine hesitancy we note. When we look at our data for the management of this wave, for example, the areas in St. Lucia where we have the lowest vaccine uptake are the areas where we see the most cases. Our age group, 25 to 49 years, where we get the most cases, is the lowest in terms of vaccine uptake. And the areas in St. Lucia with the lowest vaccine uptake as well is the areas we see coming into our respiratory hospital with the more severe cases and also the deaths. So our data clearly shows the impact that the lower vaccination areas are having, both with access to care on our health institutions and also for the poor outcomes of those persons who are unvaccinated.
Alvin Lindsay.
Yes, final question for me, and this goes to Dr. Anton Best. Could you, at this point, tell us what the rate of reinfections are at this point?
No. Seriously speaking, we have had over the last, from the time that the COVID epidemic began. So over the last 19 months, we have had a few cases of persons who were positive again, and we queried if they were reinfected cases or if these were instances of reinfection. Right now, as far as I understand it, it's only a handful of probable reinfections, but reinfections is a rare thing. A lot of the talk around reinfections has to do with how testing is done. So we do a PCR test, which is an exceedingly sensitive test for COVID-19. The problem with doing the PCR test is that it's looking for DNA fragments of the actual virus. The problem with the virus is that even when you are no longer actively shedding viable virus, meaning that you've gotten over your contagious phase, you actually still have the presence of the DNA. You're still producing fragments of it, and your PCR test is going to pick it up. So if you're doing the PCR test, it is possible that somebody who got over COVID can be positive again on the PCR test. And that is what was happening in many instances. It's also published in many places where they thought they were seeing instances of reinfection, but it wasn't reinfection. But as far as I know, there's probably only a handful there's only a handful of probable reinfected cases that we have seen. And we've seen many thousands of cases. In fact, we're close to 17,000 cases over the last 19 months.
Just a quick follow-up. When you said a handful, you're talking about under 100. Could you give me a?
I'm talking literally. I can count them on one hand. Very, very few.
I just wanted to follow that up quickly, David. I know you didn't request that I speak, but reinfection is not written up in the literature worldwide as something that is happening. We are not yet seeing science which supports a situation like what occurs with dengue, with the different strains, and the ability to therefore get dengue more than once. And we hope that never happens with COVID-19.
Katrina King has asked, when was the last time Barbados submitted samples to CARPHA, and what were the results?
Unfortunately, I don't have that information.
And I don't give out country results unless the country has announced them first.
Okay, thank you.
Mr. Moots is smiling.
Any other questions from the media? If there are none, I want to take this opportunity to thank the panelists for coming and sharing their experiences. And as you leave us, I suppose the parting comment that I should ask of each of you is, how do you see the way forward? Let's begin with you, Dr. St.
The first thing that we need to admit to ourselves is that it's not going to go back to what it was like before COVID. Number one, it shouldn't. There were a lot of things that were just really wrong that are showing up through the experience of COVID. The second thing we need to admit to ourselves is that we need to re-engineer our processes. And it's not just the health sector, all health sectors need to re-engineer their processes so that they can live safely with COVID. Now, that is something different from a let it rip, let it burn through the society kind of ethos. I'm not talking that at all. And if you look at CARPHA's website on the COVID page, you will see that we have a very wide range of protocols for safe conduct of work in many sectors. And we even have a specific tourism and health program where we started going back into country with St. Lucia, where we did an intervention with St. Lucia's tourism sector to ensure that we are not only being safe with the COVID situation, but we're improving the quality of the tourism product, especially from the health perspective. So we have to look at re-engineering our services, our sectors, And that is going to need some regional strengthening, including the strengthening of our information technology systems and bandwidth. We're still going to have to be looking at some more virtual activities. The way forward also includes a greater number, a better vaccination coverage, and CARPHA will also support, as soon as we can, the approval or recommendation of any other COVID treatments. We've got some really interesting looking COVID treatments being approved. And once we get the necessary approvals at the WHO level and we can do the recommendations, we will also do that, because I think going forward, we've got to be as sophisticated as we can with the treatment of COVID, not just for the acute case, but also for the long COVID, which is something I greatly fear in terms of the capacity of the member states to deal with the burden of long COVID, which is building. Over.
What are some of these interesting treatments that you see on the horizon?
Oh, I can't remember the name. There's one that was presented. Hold on a minute. Let me get my cell phone. But what we have done recently through our carbon regulatory system, where we do approve new treatments once they have WHO approval, we would have implemented, and it's in use in some of the member states, the recommendations for monoclonal antibodies. There are some new antiviral pills from Merck that we're going to look at as soon as we get that WHO approval, because we have a relationship with WHO. So when something new is approved for COVID, including vaccines, the vaccines that are in use that are WHO approved, we have all sent out the recommendations to the member states. So the monoclonal antibodies, which are in use already, and then the antiviral pills from Merck's. So we're looking at those once we get the approvals to recommend their use in the CARICOM region.
Thank you. And quickly from the others, Dr. Sharon Belmar-George, how do you see the way forward?
Thanks again. For us in St. Lucia, I think we need to look at what COVID has done over the last 2 years. And when I think back in December of 2019 into January, the initial forecast was that COVID would affect us for 2 years. So a lot of us, our planning was we would see COVID, it would come, and within 2 years, it should get better and we would start moving on. And we are now at the end of that 2 years with a Delta strain, when most of us were thinking we were almost out of the woods with the vaccine, we will quickly be able to get to normal life. So I think we need to look at it now and accept COVID is here for a long time. And we need to plan, use the data to plan. Like I indicated earlier, our outlook in phase 5 for us is living safely with COVID. Knowing that COVID is going to be there, we're going to be managing and plan to manage small waves where our surveillance system is extremely important, so that once we see a new risk, we're able to effectively target and manage to allow. So using our data for planning, the importance of a multi-sectoral approach at every phase, ensuring all stakeholders are engaged for full cooperation and effective communication as well. That is one of the areas that I think for most of us, we need strengthening moving forward and ensuring that whatever we implement in country is well adapted to the traditions and culture of the country. As Dr. St. John said, vaccinate, vaccinate, vaccinate. I think if most of our countries can get to 80 or 90%, COVID will become a common cold like we are seeing in the vaccinated persons. It's very mild. Our hospital will not be close to a maximum that we are seeing, and our hospital is almost always packed with unvaccinated persons. So getting our people vaccinated has to be the key towards the way forward, where we can reduce the restrictions that we have to be implementing every time there is a major wave, and it will allow us to live safely, knowing we are in a COVID environment. The last thing I want to recommend for the way forward is to ensure we continue strengthening and maintaining all of the public health gains that we have seen with managing the pandemic. We need to maintain them, because I note when I look at our planning for Ebola, if we had kept the gains that we kept with that planning, most of us as small islands would have been in a better place. But as soon as the threat went away, most of us dropped a lot of the measures and went back to business as usual. So I really want, and I will be advocating strongly as we move and live with COVID, that we maintain those public health gains through the support of our public health agencies that we have seen so far. Thank you.
Thank you, Dr. Brathwaite, and then Dr. Best.
Yes, thanks for having me on your program. Just as my colleague just said, I think in any setting like this, we must look back and analyze what went on, see what our areas of weaknesses were, and seek to plug those areas. We need to keep a constant review of our particular protocols, and this is protocols with respect even to entry to the country, etc. And the vaccination levels, we need to continue our drive to get folk vaccinated. And I found Dr. St. John's comment very interesting, because I agree with 100%. I think the folk who promote anti-vaccine, they're very sophisticated in how they go about messaging, and we have to come at least reach to their level of sophistication and surpass it if we are going to get significant numbers of people, more significant numbers of people vaccinated. And then to try to access the treatments that have come available, although most of these treatments unfortunately come at considerable costs, but nevertheless it's about trying to save lives, and as far as the country can afford, to try to get both the monoclonal antibodies and the antivirals in. If we had access to those and folk had been able to take them, perhaps our mortality figures would not have been at the level that they are. So we've got to live with COVID, and we've got to look at the social consequences of COVID, and as well, but also keep a very keen eye on the biology and what is happening with COVID. Whatever is happening, however COVID determines that it is going to move, we have to be cognizant of it and react accordingly. We cannot just go nilly-willy and move without taking careful consideration of what is happening with the biology of the virus and what is happening globally.
Thank you. Finally, Dr. Anton Best.
Thanks again, Mr. Ellis, and thanks all for the opportunity to be here this morning. Mr. Ellis, there isn't much more I can add. I think everybody has said the suite of strategies and the approach and the thinking that is required for any country. What is going to differ is the extent to which you have to address particular problems and identify nuances in every country. So for instance, we talked a lot about vaccine hesitancy. There is vaccine hesitancy in Barbados. It might be a little bit less here than it is elsewhere, but nevertheless, it's something that is commonly seen, not only in the region, but we are seeing it in many other countries, many other jurisdictions as well. I would have talked about the public health and social measures. These need to be continued. But we also need to be strategic. Remember, we have a whole suite of public health and social measures. We have to apply what makes sense for the time, for the context. We have to be guided by the evidence. The other concern that I have, we talked a lot in the last few minutes about living safely with COVID. The other concern that I have that has been raised during the last hour and 20 minutes of this discussion is what is happening to the other aspects of healthcare in Barbados. What is happening with NCDs? Are we going to see a rise in myocardial infarctions in 2 years, 5 years, 10 years from now because of what is happening with COVID? What is happening with the EPI program? EPI is expanded program for immunization. I'm very concerned that our childhood immunization is taking a beating because of COVID. All right, so it's about living safely with COVID, but it's also about paying close attention to what else is happening where health is concerned. I'm also very concerned about mental health of my colleagues, mental health of persons working in isolation, in quarantine, in the polyclinics. I'm extremely concerned about that in the short term, the medium term, and the long term. But it all boils down to two last things I'm going to say. Mission critical for Barbados right now is saving lives. But we are not going to be able to do it by ourselves in the Ministry of Health and Wellness. We need a whole of government approach. So other government agencies need to come on board, but we also need a whole of society approach. So we need civil society organizations, we need faith-based organizations, we need people to understand what is it we're trying to do, and let us help you, help us to help you. It boils down to individual choices and individual behaviors.
Thank you. And thanks to all of you for participating in today's exercise. Dr. Bert Brathwaite, Dr. Joyce St. John, Dr. Sharon Belmar-George, and to you, Dr. Anton Best. And a special thank you to the members of the media who shared this particular project with us today. I'm David Ellis.